Hello, everyone. Welcome. So great to see so many people signing on. I'm Michelle Buzark. I'm a senior researcher here at the Center for Early Learning Funding Equity, and I'm the project lead for the Early Learning Shortchanged project. We are so excited to share some of our new findings with you today and to learn from our friends at Rapid about some of the findings that they have uncovered recently. So I have the distinct pleasure of introducing our panelists today. Teresa Hawley is our executive director here at Selfie. Teresa is a developmental psychologist by training and previously served as the first assistant deputy governor for education and the executive director for the governor's office of early childhood development for the state of Illinois. Katie Nicolau is the project lead for the Rapid Survey Project, which is based at the Stanford Center for Early Childhood. Before coming to Stanford, she was the project manager at Early Milestones, Colorado, and she began her career as a second grade teacher. Miriam Calderon is the vice president for Impact at the W.K. Kellogg Foundation. With over 20 years of leadership experience in early childhood policy and systems, she has held key roles at 0 to 3, the U.S. Departments of Education and Health and Human Services, and led Oregon's early learning systems. So today, Teresa will present new findings from the Shortchanged Project, Katie will present findings from the Rapid Survey Project, and Miriam will provide comments on both. Then we'll have what I'm sure will be a very lively panel conversation about the state of early learning, early care and education in the country today, and then how this research can be leveraged for the most impact. So my team will be monitoring the Q&A tab, so please put your questions in the tab as they come to you, and we will get to them at the end of our conversation today. So with that, I will pass it over to my colleague Teresa, who will tell you about the Shortchanged Project.
Welcome, everyone, and so glad to have you here on our webinar today to talk about a project that's been very near and dear to my heart. It's something I'm really excited for us to be able to do at Selfie, to take stock of exactly how much money we're spending on early care and education. I apologize, as we got started here, it seemed that my Zoom was showing just a little bit of a bubble. I want to make sure that it is showing what we are supposed to be seeing here of our slides. So hopefully what you're seeing right now is a little slide that's saying, why do we track public investments in early care and education? That's really what this project is about. We want to understand how much we are actually spending in early care and education. And it's very complicated to do this because it's not a straight shot like the K-12 system is. In the K-12 system, there's a very well organized set of information about how much is being spent at the state level and at the local level and at the federal level. All those statistics, historically at least, have been gathered up and provided for us on a national level. But for early childhood, it really just isn't like that. There's a bunch of different pots of money that get tracked, and it's hard for us to know exactly how much has been spent. One step back before we step forward into the work that we're going to talk about today. I always do this because in early childhood, we absolutely know that there is a whole network of systems that children and families need to be able to thrive. That includes everything from healthcare services to economic supports for families, libraries, parks, all of that good stuff. But today, we're going to focus in on what Selfie focuses on all the time, which is the early care and education part of the early childhood system that supports children and families across the country. So we're going to talk today about the money that gets spent on things like childcare, pre-K, home visiting, Head Start, all of that, and try to understand why it's so hard for us to know exactly what is being currently spent on this. So if folks have joined us in our webinar several months ago, we did our first launch of this project where we showed you some data from 2021. Today, we're going to share a little bit of update of that data in 2022 and sort of get a little deeper into the heart of the challenge that we've been facing with this project, which is understanding how much money is being spent. It's hard to know because the money gets spent in so many different ways. It's a very fractured system. We like to call this our spaghetti chart for Illinois. It's our way of laying out how the money actually flows in early childhood, all the different agencies that money comes from in order to fund early care and education services, all the different federal agencies, state agencies, local administrators, that the money may flow through on its way down to a provider who actually gives the services to young children and families. This is the way our system works, and tracking that money, figuring out how much is actually spent, is really complicated. Some of that money does get tracked pretty easily, like Head Start, early Head Start, because it is a direct federal to local expenditure. We have some pretty good records on that. Our friends at NEAR have done a bang up job of tracking all the money that's being spent on state pre-K across the country, and we built upon that in this project. But we can tell you, when it comes to these other sources of money, like the Child Care Development Fund and the money that's actually being spent on childcare beyond what this is being spent at the federal level, or that is specifically matched to the federal level, or the money that's being spent by states on early intervention beyond anything that's provided by the feds or specifically required to be reported back to the feds, there's a lot of money hanging out in this system that that is hard to track. It's hard to figure out. So what that requires, and what we've been doing here at Selfie, is then going to the actual state budgets, line by line, finding all the money that's being spent on these early care and education parts of their budget. Importantly, this project tracks what's being expended. So it's necessarily in arrears. I said earlier, we showed you a few months ago 2021 data. Now we're able to show you some 2022 data. We recognize that it is in fact 2025. We know that we're a little bit behind in what we're able to put out there. This is because what we're doing is getting the actual expenditures, which take a couple years to show up, and we're tracking those actual expenditures and creating a historical record of all the money that's being spent in early care and education in this country. So as I said, we're digging deeper into this because many states spend a lot more money than actually being reported. When I was in the governor's office in Illinois about 15 years ago, getting started in this work at the state level, it used to drive me crazy because I'd see these reports about how much money was being spent on childcare in Illinois, and I'd be like, I know we spend a lot more than that. Well, I don't know why all these national reports only say that we spend this much money. Well, I discovered this because what you report to the feds is specifically what is being spent as matched to that CCDF program, or that's TANF transfer or matched to a TANF transfer. We didn't do it quite that way in Illinois. We spent the money a little bit differently. And so a lot of the effort that we were putting forth in early care and education wasn't really getting reported or recorded. In fact, in Illinois right now, we're spending, in 2022, we spent $269 million more than would have shown up on any of those national reports about how much is being spent in early care and education. So that's why we're creating this national report, to get a much more accurate view of what is being spent in early care and education. A few other things that are specific to our project and that kind of set it apart from other efforts that are out there is we are trying to look at the early care and education system as a whole. As I said, there are reports out there that show you Head Start, they show you state pre-K, they show you the child care part. We're trying to put that all together and look at that system as a whole. Also importantly, we're breaking it out by age group. How much are we spending on infants and toddlers? How much are we spending on 3 to 5-year-olds? How does that compare to the money that's being spent on K-12? And of course, there's parts of the system that are, childcare goes across all those age groups, so we make sure we're partialing it out. We're also looking at comparing across states the investments that are made in these different funding streams, and that's where we're really trying to go. We're trying to get to a true 50-state accounting of the resources that's going to allow for some apples to apples comparisons across states about the effort that's being put into funding early care and education. All of this in the service of helping you better advocate for more resources being put into the early care and education sector. One of the things that's really interesting that we can do as we get all of the funding streams tracked all across the country is to pull out specific funding streams and show what impact. And this has been highlighted for us, the importance of this, just in the last couple of months, when there was talk out at the federal level of, might Head Start be zeroed out in the federal budget? Well, what would that actually mean to states? It would mean a little bit different things to different states, depending on how reliant those state systems are on the Head Start funding stream as their primary funding stream. What you can see on this map, and we'll talk about this when we get to the website later, these are the states that are in color here are the states that we have completed the mapping of the 2022 resources. The remaining roughly 20 states we're going to be getting to over the course of the summer. Stay tuned, we would love your help. But what you can see here on this map is an accounting of, if you just look at Head Start and early Head Start, what percent of the whole expenditure for early care and education is that for that state? The big different story here out in California, where it's only around 20% of all the money that's being spent in early care and education, versus a Mississippi where it's over 60% of the money that is spent in early care and education is actually the Head Start money. So if Head Start were to be pulled out of the overall funding scene, it will have a very different effect on different states. Things that the tool that we're creating, this tool of expenditures in across all these early care and education funding streams, will allow us to do moving forward, and to produce this kind of information, help you guys, the advocates out there, to be able to share this information and make the case for why these resources are so critically important. So I'm going to give you a little bit of like, what did we find in 2022? In 2021, we with our previous presentation, we shared with you that, not surprisingly, we spend a lot more on K-12 than we spend for kids in the birth to 5 years. And we can see that again in 2022. But we also shared that things hadn't changed a whole lot in the 10 years since our great colleague Charlie Bruner had done this for the BUILD initiative about 10 years ago. What did we find as we move forward now? Well, again, reminding you what we're going to do here is to break it out by 0 to 3, 3 to kindergarten entry, and the K-12 years. So the children who are 5 years old up to 18 and a half, essentially, is how we break it out. We assign the funding streams to the right age groups, or if the funding stream crosses age groups, we have methodology for apportioning the money. If you're really interested in those sort of geeky details, they're all in our first Shortchanged report, which is on our website that we'll show you in a moment. So again, what did we find? Headline here, and we recognize some of you guys have taken this chart. We've seen it pop up on social media. We've seen it pop up in other people's presentations. This warms our heart. Please share with us your stories if you've been able to use this graph and use this information in your work out there. Would love to hear about it. That's why we're doing it. But this is the money shot, literally. What we found is that the U.S. invests about 86% less in education and care for kids in 0 to K entry than they do in school-age children, and it's even less for 0 to 3 than it is for 3 to 5. I think what's also very interesting about this chart is, if you look at the blue part here, that is the federal expenditure. The federal expenditure is actually pretty even across the age groups. It's not that the federal government spends a lot less for kids when they're birth through 5 than they spend once they're in kindergarten. It's the states and the local that are spending so much less. Obviously, state K-12 education is a primarily state and local responsibility. This chart shows that hasn't transferred over to the 0 to 5-year-olds, so we don't have as much of an investment there in those younger ages. What's the difference from what we found in 2021? Well, we found actually that early care and education investments were slightly down from 2021 to 22. This was almost entirely because the child dependent tax credit in 2021, that data showed much higher use of that. There was policy in place to allow a larger credit at that time. And then in 2022, that data, it's not, that amount isn't there as much anymore. So those kind of variations year to year, variations that we can see in individual funding streams, are part of the reason for doing this project, for keeping that record over time of how much we're actually investing in early care and education across all states. As I said, part of the motivation for doing this is to create a bit of a leaderboard here. We understand who are really investing the most in early care and education. To do that, we need to dig down on the individual states. So two will show up in our analyses here. First is the nationally reported expenditures. That's the stuff that everybody has already been tracking and that we just put together and gathered up. So the stuff from near the data that's there at the federal level. And then the state specific expenditures. This is our going through, combing through the budgets line by line, figuring that out. So far, we've gotten through 30 states to see what their ECE expenditures are. And in doing so, we've captured over $3.7 billion that were spent in 2022 on early care and education that were not accounted for in those national levels. It's about 10% of the total that invested out. The national report had roughly a total of 40 billion, and we found almost another 4, and we're only through 30 states so far. An example of this that you can see in Maine, if you look at just the nationally reported expenditures, $127 million, but if you look at their actual expenditures, $173 million, the difference captured there is pretty substantial, $46 million more that was being spent by Maine that was being captured in those national reports. And really significantly, we know that they're on track to spend even more. We know they did spend more in 2023 and 2024 and 2025. They have been continuing to invest in their early care and education system. We want to make sure we're capturing that and tracking that over time. These kind of investments vary. Not every state is putting as much money into the early care and education system. So here you can see Oregon has invested a whole lot more, especially in their 3 to 5 year olds, than we're seeing in Alaska. And again, the federal dollars may not be that different here, there, the lighter blue on the bottom, but the state and local dollars are certainly different across these states. And that's what we're trying to create, that sort of leaderboard to understand. So we encourage you to go to our website, shortchangeproject.com. There you're going to find a whole lot of resources. You're going to find our main report that was done for the 2021 data. Stay tuned for this fall. We'll have out another report with the 2020 or the 2022 data all updated. The 2021 data is on the site. And then you'll be able to look at our map here and click on, if your state is highlighted here, then we have already done the analysis of that. Importantly, if your state is not, and you have, if you can help us to get access to that expenditure level data from your state budgets, we would love to talk with you and get your help in making sure we fill this all out. It's our goal to have this whole map filled in by the end of the summer and be able to create, like I said, that leaderboard. So we encourage you to visit shortchangeproject.com and see what we've been able to track in terms of our state-by-state analysis of this data. Got lots of folks to thank here. We have a great advisory group of many of the national organizations that work on early care and education who have helped us to create this, and very much appreciate the support of the Saul Zaentz Foundation who helped us build that website, and Heising, Simon, and Bainham who helped support our work in this area. So I'm going to now turn it over to Katie Nicolau from the Stanford Early Childhood Center. And she's going to share with us a little bit on what does this all mean then in the lives of young children and families? What is the impact of us spending so little on early care and education?
Just bear with me 1 second, folks, while I get my slides up. Thank you. All right. I'm having issues with my slides, as you can probably tell. So we will try to get that as best I can to work. Okay. Thank you, Teresa, and thank you to the Selfie team for inviting me to participate in today's webinar. My goal is to complement the rich systems level findings from the Shortchanged project that Teresa just shared by highlighting some of the insights from the Rapid Survey project and specifically Rapid's national surveys. Over the past 5 years, Rapid's national surveys have provided valuable information on how parents and childcare providers are experiencing the system. So we will dive right in. So Rapid is a survey project that launched first in April 2020 to understand the experiences of families with at least one child under age 6 during the pandemic. And then about a year later, in spring 2021, we introduced a parallel national survey of childcare providers to capture their experiences as well. Both surveys are ongoing. Each month, we recruit new participants and invite existing participants to complete follow-up surveys. So this allows us to track trends and document the evolving experiences of parents and providers over time. Rapid surveys are designed to elevate the experiences and voices of all adults in young children's lives, providing timely, actionable data and promoting and informing data-informed programs, advocacy, and policymaking. So to date, we've gathered over 22,000 responses from parents and over 12,000 responses from providers in all 50 states and DC. And each survey is a 15-minute paid questionnaire that can be completed on any device that can access the internet. And our surveys are available in English and Spanish. So we dedicate or we use a dedicated set of core, what we call core modules in every Rapid monthly survey. So those include topics like emotional well-being and measuring levels of anxiety, depression, loneliness, and stress, as well as material hardship, capturing economic well-being, including housing, food insecurity, topics like that. We ask about childcare. So for parents, we ask about access to childcare, their preferences and challenges. And for providers, we focus on their experiences providing care and their working conditions. We also include open-ended questions in every survey. Things like what's helping you and your family most right now? What are your biggest challenges? Top questions like that. And then one key advantage of this approach of having these core topic modules embedded in each monthly survey is that we can also remain responsive to current needs. So in addition to the topical modules, we can add one-time or last minute modules to address emerging priority issues like families' experiences with inflation or extreme weather or providers' experiences with student loan debt, things like that. So our survey content is really a combination of these core topic modules and topical modules that we add over time. So we're going to take a look at findings from both national surveys related first to material hardship and emotional well-being. Here you see data we've collected from April 2020 through April 2025, which show the percentage of parents with young children under age 6 who told us they were experiencing at least one area of material hardship. And we define material hardship as difficulty paying for basic needs in one or more of the following categories. That's food, housing, utilities, childcare, healthcare, and activities that support well-being, such as counseling. And we see the lowest rates of material hardship coincided with the implementation of pandemic era economic stimulus and supports like the child tax credit. And then once these pandemic era benefits expired, we saw a spike in material hardship rates and have continued to see that over a third of parents have been experiencing material hardship consistently over the past 2 years. And we also can take a closer look here at the material hardship data from Rapid's provider survey. Since Rapid began tracking this information in 2021, the proportion of childcare providers reporting difficulty meeting basic needs has not dropped below roughly 1/3 of providers. And over the past year, this rate has increased really significantly. Looking back in April 2024, the rate was around 42% to just in March of 2025, jumping to 71% of providers. So there's a substantial rise in financial strain among providers that we're seeing. And we have recently been seeing more babysitters and nannies participating in Rapid's provider survey, and a sharp increase in hardship rates among these caregivers may be contributing to the recent spike in overall provider hardship. But despite some fluctuations, the rate has really stayed consistently affecting more than 1/3, up at times up to half or over half of childcare providers for several years. So not so dissimilar to what we've been seeing among parents as well. And this persistent financial insecurity we know has implications for both the well-being of providers and the quality of care that they can offer, which we'll get into later on as well. So we assess emotional distress among caregivers by tracking symptoms related to stress and loneliness, anxiety, and depression. So, for example, we ask if in the past month, provider or caregivers have been feeling nervous, anxious, or on edge, or unable to stop controlling or to stop or control worrying. And we classify them as experiencing that type of distress if they say they've been having those feelings for at least several days, more than half of the days, or nearly every day in the past month. And the data presented here were collected in March 2025, but these patterns have remained consistent since the start of data collection, with emotional distress symptoms being widespread among both parents and childcare providers, with stress being the most commonly reported symptom. And one of the most consistent findings in the rapid data is a chain reaction of hardship. As parents are experiencing greater material hardship, they're also reporting higher levels of emotional distress, including these symptoms of stress, anxiety, depression, and loneliness. And the increase in parental distress is associated with higher reported emotional distress in their young children. So we're seeing this sort of ripple effect within families. And over the past 5 years of rapid surveys, we've consistently observed this progression of material hardship leading to increased parental emotional distress, in turn affecting children's emotional well-being. And as for the impact on providers, those experiencing material hardship are also reporting higher levels of emotional distress, which is particularly concerning given the already elevated distress levels among providers. And this connection between financial hardship and emotional well-being really highlights the need for more targeted support for both parents and for providers. Switching gears here a little bit, I want to highlight a key finding from our National Household Survey. And this chart illustrates the types of childcare that parents are using for their infants and toddlers. So according to our rapid data, 68% of parents with infants and toddlers are using childcare for 5 hours or more per week. And among these families using childcare, and consistent with other national findings, family, friend, and neighbor care represents the largest share of childcare arrangements for this age group. So think a neighbor or an aunt or perhaps a grandmother caring for a child or a group of children in a more informal setting. And 39% of those parents with infants and toddlers are choosing some form of FFN care, we've found, whether that be paid or unpaid. And I think this is really important to emphasize as we're here discussing investments in early childhood education, because it underscores just how significant and prominent or FFN care is within the early childhood landscape. And despite it being so prevalent, FFN care remains largely underfunded and under-recognized in the broader early care and education system. For example, we know that family friend and neighbor caregivers are often ineligible for many public financial supports and quality improvement initiatives, and that they frequently lack policy attention. So, a final quantitative finding I'll share from Rapid's National Provider Survey is the trend of providers experiencing staffing shortages in the setting in which they're working. And we see that trend here over time. And we see it ebb and flow over the past few years, with a peak of 100% of providers reporting staffing shortages in July 2023, and now down to 37% in December 2024. But that's still well over a third of providers working in a setting that is experiencing a staffing shortage. And I've included a quote from a center teacher here who shared that the lack of staffing has caused a significant increase in stress levels and exhaustion. I'm working 50 plus hours per week just to keep it running. And we dig into that a bit more and taken a closer look at how staffing shortages are impacting providers' well-being. And 80% of providers have told us that reporting staffing shortages have told us that they feel more stressed. 67% feel exhausted or burned out. 43% find it harder to decompress and engage in activities outside of work. 40% feel more anxious, and 15% feel more depressed. So, another quote here, one home-based provider shared that I can't handle the instability of this career after 12 years. It is taking a toll on my family and my mental health. So we know that high stress, among other factors, drives turnover rates, which in turn perpetuates these staffing shortages, and it increases emotional distress for those providers who are remaining in the field. And this cycle can have significant impacts on children and their families when the quality of care is being reduced or relationships are being disrupted due to staffing shortages. So, as you've gotten a sense of over the past couple of slides, Rapid also collects qualitative data, and I wanted to share some more quotes to bring caregivers' voices into our virtual space today. We've asked providers, what do you want federal and/or state officials that oversee funding for childcare providers to know? And I'll give you a minute here to read through these quotes. So I think what stands out here is the real lived experiences of providers as they navigate this really complex system. And the system, it's one that demands significant time and attention, even as providers remain deeply committed to delivering high quality care for children. We've also asked parents, what would you like your elected officials or other policymakers to know about how your family is doing or what you need during this time? And I'll pause just for a moment to let you read these quotes as well. So again, I think these quotes really powerfully illustrate in parents' own words some of the challenges that they're facing, such as inaccessible or unaffordable childcare, and balancing their own careers while trying to make their childcare arrangements work for their families. And I think these capture, yeah, that those challenges that they're facing in a poignant way. So before I wrap up, I want to briefly highlight some of the additional work that Rapid is doing beyond our national surveys, which I shared findings from with you today. Over the past few years, we've partnered with county and state-based organizations to co-design and implement place-based rapid surveys. And this approach allows us to take a more bespoke approach to listening to parents of young children within local communities and to help meet local data needs. As you can see on this map, these are the locations where we've established current and former partnerships through our Community Voices work. And although they're not shown on this map, Rapid's also now working with organizations in Hawaii and Vermont, and we're using our national household survey infrastructure in these states to oversample and gather richer data from parents with young children. And looking ahead, we're planning to expand this work beyond the pilot phase to additional states in the coming year in response to the growing demand for state level data. So before I pass it back to Michelle, I'll just leave you with a few ways that you can learn more about Rapid and stay in touch. We publish findings and fact sheets as well as trend data from our national parent and provider surveys on our website, rapidsurveyproject.com. You can also scroll down to the bottom of the website to subscribe to our newsletter, and you can follow the Stanford Center on Early Childhood on social media. These slides will also be shared with you after the webinar, I believe. So hopefully you'll be able to access these links easily that way. But I want to thank you all for your time today. And here's my contact information. Please don't hesitate to reach out if you have questions about Rapid. And I'm looking forward to the rest of our discussion. Thank you.
Thank you so much, Katie and Teresa. Wow, there's a lot to unpack there. Miriam, you have worn so many different hats in the early childhood space. I'm curious what stood out to you in those presentations. What did they bring to mind for you?
Yeah, thank you so much, Michelle. I'm really excited to be here. I want to thank you, Katie, for that terrific information, and you, Teresa, for the important work behind the Shortchanged project, you and your team, and just also shout out to your leadership in the field, particularly on these issues of financing for early care and education, which I know is your passion. So I thought just four quick points, and then very much looking forward to the Q&A and discussion. I think the first, just, state the obvious. These data confirm we invest the least in children during the years they need it the most, especially our infants and toddlers. And that's in direct contrast to what the brain size tells us, right, is most effective and the most consequential period in human development. I think you all know that. But I think I just wanted to really start with this because I think when we lift this up, it can be really powerful. I want to share a story from when I worked for the former governor of Oregon, Kate Brown. We were working on our early learning strategic plan, Raise Up Oregon 5-year plan, really setting out our North Star for the state very comprehensively, but had obviously a huge focus was early care and education and addressing the challenges in our system. So we sort of did a Herculean effort to try to find the data as comprehensive as we could, broken out by age groups, much like what the Shortchanged project is presenting here, and really looking at our state expenditures. And we included that chart in our early learning strategic plan. And we actually added the brain science, right? And we showed when, the period of time beginning, prenatally through young adulthood and in terms of the developing brain. So as you can imagine, the chart ended up going like this, right? Here's brain science, right? Prenatally as children age. And here were our investments. So hopefully I'm doing this literal thing because that's what our governor did every time she talked. That chart made such an impact on her, right? And she'd talk about our early learning strategic plan, Raise Up Oregon, and she'd and look at this, we invest the least at the time, right? When the brain science tells us that children sort of need it the most. So I really wanted to start there. We went on during her tenure to have to secure the largest investments in the state's history in early care and education and establish a new cabinet level department for early learning and care. So you can't credit it all entirely to the chart, but I just want to say it's really, really important for us to put this picture together, right? Um, and the thing that I want to say next about that is just to emphasize it was really hard to do. And I don't think Oregon is unique, right? In being able, even within the state, as we administered many of these programs, and it was still challenging for us with the capacity and the infrastructure that we had to be able to paint the picture. I love that Teresa started by shouting out Charlie Bruner and the Early Learning Left Out report. Right, because okay, this is a 20 plus years. It was 12 states, I believe, a multi-year effort. Here we are, again, like 20 plus years later, Selfie is doing a lot of work, has reached 30 states and counting, and trying to make this data accessible. And at the same time, I think there's more to talk about. And I'm sure we'll get into this on the panel of like, why is it really still this difficult to be able to paint a comprehensive picture of state and federal expenditures. And like, why does that matter? We know we need this information to make the case for greater investment, but I think it's also because we need to really understand where the dollars are going in a community to be able to target the resources most effectively. And I think as a former early learning administrator, again, in Washington and Oregon, I often felt like we were making decisions really kind of somewhat in the dark or by funding stream, right? So we would look at state pre-K, or we would look at home visiting, and we would have maybe information about where the dollars that we were directly administering were going, but we didn't know the full picture, right? And it is really, really important that we get down to that level so we can fairly distribute all of the available funds that we have. The third point I want to really bring in is I love and appreciate hearing always the rapid data and how we center the voice of our providers and our families in this work. And I think it is a really important complement to the data that we have around where the expenditures are going, right? Because I think that really puts um, what the implications are of just the scarcity of funding, the lack of coherence in funding, right? And how that impacts, what is available, or really what the system is that families and providers experience every day. And I think you heard that so clearly, right, in the work that Katie and the survey findings that Katie is lifting up. So they experience this lack of coherence and scarcity very directly. And those are sometimes community to community. They're also within program differences, right? So this can be based on the setting. Katie lifted up family, friend, and neighbor care. It can be because of the funding stream, right? And which programs are able to really access those public dollars. We know that the public financing really shapes the supply and the availability and the quality of the early care and education, that is available. And finally, I think our parents and our providers are some of our best voices right now, in really being able to lift up this challenge. And it's like those stories that are really breaking through, and they're the ones that are also, important to shape the system that we want to build in the future. And I'll just, share a quick, point about that. I think in particular at this time of, a lot of partisanship and divide across ideological lines. I wanted to lift up a poll put out by 0 to 3 a few years ago that asked the question about whose responsibility it was to fix this, to fix the long wait list, the lack of supply, the lack of infant and toddler care, right? All of these challenges that you all know and well in our early care and education system. And it was, across political parties, across states, what you would call red state and blue states, parents, the majority of parents that responded, of infants and toddlers that responded to this survey, said it's the government's responsibility to fix this. And I think that was really a real turning point for our field, right? Because so much of this burden has really been felt by providers and families as an individual responsibility. And I think that is important to say, across the ideological divides or partisan divides, families want government to solve this, right? And engage. I know that don't misunderstand me. There are concerns about government run things. I'm not saying that, but I think exercising sort of more in their role, right? And I really think that gets down to funding, because we know that parents can't afford to pay what the cost of this care is. And then I'm going to say, I think the closing point to that, finally, I think this data really help us understand, I think in a very critical moment, right, that the federal investments still really matter, and are making a difference, in states and communities. And so as we think about funding uncertainties, right, particularly changes at the federal level, but even in states, as states are reacting to some of the budget pressures because of the federal changes, right? I think it is important to have this kind of data and information, at our fingertips. So thank you so much for the opportunity to be here, and I will pass it back to you, Michelle.
Thank you. Those were wonderful comments. Okay, so Miriam, you've already touched on this a bit, but I want to push on it a little bit further to see if there are any other like tangible ideas that come up about how to use these two bodies of research to promote more public investment. We all like it's so clear that we just chronically underinvest in kids before they enter kindergarten, and and we haven't made that much progress over the last decade. And so now is a different moment. What can we do next with this information? Miriam, I'll go to you, and then Teresa, and then Katie.
Yeah, I mean, I'm happy to just kick us off. Again, I think about what can we do to really make this transparent and accessible, and kind of put this information, in the again, to my comments, really in the hands of families and providers. So I think their voices are critical right now, right, to be able to defend the resources that we have, and and be able to really be the voice for not only securing the additional resources, but really directing the resources to where they go next. The other thing I was thinking about really in this question, and I think the power like of these data, right, is the fact that we know that federal administrations change, governors change, local leadership changes, at the local level, and you know pretty much at all these levels, and that impacts the progress that we're making, right? And I think that I always think a lot about the fact that there's really not a rights frame to early care and education yet, or a guarantee, right? And these often are budget line items that are tertiary, right? So they grow depending on the leader. They sometimes can even go backwards, right? We can lose ground and progress, right, because of some of these transitions and leaderships. And I know that is a concern now. And so I think that, again, that comprehensive picture is critical right now. And that this level of data and information provides. And I think it's especially important, to be able to lift up the gaps, I think particularly for our infants and toddlers, and to show kind of where we are, where we're making progress. So I think defense and growing it, but particularly at this time, I think it's critical because of these changes, and because we know that dollars, you can make progress and then retract. It's really important to have that baseline. So those are some of my thoughts, but eager to hear others.
Yeah, I would echo all of that, and would also say, like, don't be afraid to get competitive. Or to don't underestimate the power of competition in a governor's mind, and spurring on investments in early care and education is part of the reason why we want to create that leaderboard and understand what folks are spending state by state. I also think it's really, like, when Miriam was talking about the graph of the brain development versus the investment. It really does have impact on people, and I think keeping that, like, people have asked us, why do you put the K-12 there? Why is that your benchmark? Partly it's just because the contrast is so enormous. And so when you get to a moment where somebody's trying to say, we spend a lot on early childhood, we need to cut it back, you can be like, really? Because I mean, look, comparatively, we spend almost nothing. Or when we get to, like, okay, we want to think about what would it take to make what Charlie Bruner always called the big leap forward. How are we going to get from these pennies on the dollar to the real investment? It helps put in context just how far that really is. Like, doubling what we spend in early care and education just frankly isn't actually going to get us there. It's many multiples. So it helps to keep that eye on the prize and that context. And I also I just really love the way we set up this webinar today, because you cannot talk about the money without talking about the actual impact on kids and families, which is and the providers, which is, I think, is so important. Whenever anyone is out there using this data, putting them together is just so critically important.
Can I just build on one thing you said, Teresa? I really so glad you mentioned that, like looking at the state, within across state kind of comparisons and things like that, and the power of that. Both of my experiences in Washington, D.C., implementing universal preschool, I think one of the questions I was most often asked around lawmakers, like, what are other cities doing that have already done this, right? Like, what can we learn? And then similarly, like in Oregon, I'm not going to say we were super competitive with Washington and California and like our neighboring states, but, I think sometimes those regional, kind of comparisons too, it was a lever sometimes to say, oh, look at what Washington is doing, you know what I mean? Or, and I'm sure vice versa. So just wanted to underscore that.
I'll just add one quick thing to build off this conversation. And I agree with Teresa. I think the setup here today is really important for showing both the investment data as well as the parent and provider experience. And I think that Rapid and these other opportunities to elevate parent and providers' voices and experiences not only help inform the policy and give real data to go off of, but it also shows families and child care providers and helps bolster the trust between them and the systems that are serving them, to show that their experiences can help directly shape decisions.
Excuse me. Yes, so this has been such a great conversation, and I know we're running a little short on time. But Miriam, while we have you, I want to, from your role as a philanthropist now, I'm curious how philanthropy is adapting to the current moment, and what it needs to do to meet the moment. And
Yeah, thank you for that. I think one is really we are really trying to listen to communities and really understand, what, again, that like who is benefiting, who isn't, how are we building systems that are responsive? Really, philanthropy often comes in, as many of you know, really to support the public dollars, right? I think drive innovation, support leadership, support advocacy, support implementation. I think at this moment, as we hear about particularly changes at the federal level, right? Potential for cuts, growing, pressure on state and local budgets, and those things where we're trying, philanthropy cannot fill the resources that are and any kind of hole that is left by public dollars, right? And so it's really trying to think about what listening to communities, really supporting those leaders. I think continuing to in all of this, we see ebbs and flows, as I talked, leadership changes and stuff, pre this moment are part of, I think, what we need to prepare for. And I think we're helping and really thinking about with our partners and our grantees, how we can do that, but also keeping an eye also on that long term, right? Because it really, even from where we started with, while there may be some, uncertainty and cuts that we're seeing at the federal level, the status quo was also, right, not acceptable and not where we needed to be. So I think it's listening to what communities need, what programs need, leaders need, families, sort of in this moment to be able to respond, but also really thinking about what is it that we're continuing to build and really supporting that innovation and partnership, like with communities and local and state leaders.
thank you. So Katie and Teresa, Katie, I'll go to you first. What's next for the Rapid project?
Yeah, well, we're going to keep doing what we're doing in terms of fielding our monthly surveys at the national level, and continue to partner with states and communities to co-design those tools and local surveys that can reflect families' specific experiences and the priorities of the local community. We're going to be expanding our focus on how caregiver well-being shapes child outcomes, because we know that when caregivers are supported, both parents and childcare providers, that children are better able to grow and learn. And we're also going to be working on sharing the data stories that we capture through rapid surveys more widely, so that families and providers and leaders can all use the insights in ways that better support decisions.
And Teresa, what's next for Shortchanged?
Well, we're going to finish the rest of the country here. We're going to get through the rest of the states. And again, a plug out there to anybody who can help us. It can be really surprisingly difficult in some states to locate the data on expenditures. So, a lot of times people put out their budgets, but not actually what they spent. So if you see your state not covered, let us know. So we'll be doing that. We'll be putting out a report this fall that brings all that together. But then really, we got to start going even further and even deeper. We need to look at the local level. So we know that there's a lot of communities out there that are investing very significant local resources. We know in Chicago, there's a significant investment, Denver preschool program, Philadelphia preschool, like we've got lots of them out there that are putting a lot of resources into early care and education. Again, that's not getting captured. So we want to keep going until we get the most accurate representation of what we're spending in this country on early care and education.
Yep, it's exciting. And I'm going to double click on what Teresa said. Please reach out if you don't see your state represented. It's because we don't have a contact there readily available, or the data isn't publicly available in the way that we need it to be. So please reach out to me, Katie, and I will both put our contact in the chat. I know we ran out of time for audience Q&A, and I see we're doing our best to respond in real time, but please reach out to either Katie or I with follow-up questions about either the Shortchanged project or the Rapid Survey project. I want to just say a huge thank you to Katie and Miriam for joining us in this really rich conversation. And thank you to all of you for joining us today. And we hope you'll check out the Shortchanged website and the Rapid websites. And we will send the slides for this webinar and a recording in follow-up communications for this. So yes, thank you everybody so much for joining us. We hope this was as interesting and exciting for you as it was for us. And please reach out and have a wonderful afternoon.
Thank you.
Hi, thank you.
Thank you, everyone.